Strengthening of human resource in Uganda's health sector was a key area identified for the development of the Ministry of Health strategic plan that is in 2020 to 2021 and 2024 to 2025. The strategic plan underscores the pressing need for emergency medicine skills across all levels of healthcare professionals, that is to say physicians, nurses and paramedics. To aid this goal, Total Energies Uganda has taken steps to renovate the Skills Training Center and invest over $150,000, that's approximately 57 million Ugandan shillings, in advanced simulation medical equipment at Mulago Hospital. Collaborating with Makerere School of Health Sciences, the initiative addresses the scarcity of skilled emergency medical professionals and rectifies past limitations where students lacked hands-on experience and practiced on live patients. Dr. Araro Charles, representing the Ministry of Health's PS and overseeing curative services, encouraged trainees to maximize the new resources for skilling, underscoring the shift towards improved healthcare services.
My heart. We didn't have this opportunity when we were here to do what? To have such a facility. The other one which I wanted Dr. Byanyima Rosemary to have spoken is the capacities which are available here. Many of the Ugandans do not know capacities which are available in Mulago, so that actually you don't need to go out of the country. So probably Rosemary will organize and bring us for another day when you'll be able to do one. Not only in Mulago, but available in the country. Available in Uganda Cancer Institute, Uganda Heart Institute. There are really many of the issues, more than 90% of the elements can actually be handled within the country. And
request for space for this facility came in at the beginning of the year, and by April they started putting up the facility, and I'm glad that within just a couple of months, 4 months, it's now ready for utilization. It costs slightly over $150,000.
It's going to be able to improve the training of emergency physicians, and because they will expose the students to scenarios so that when they get exposed to real actual scenarios, they are aware of how to handle. So this simulation center is well managed and well coordinated, and as here where we are standing, actually, it kind of like demonstrates a full operation theater. And you've seen that somebody can be able to control it from outside. So not all the students can be here, others can be able to do one, to observe. So it's really a process which is like, previously in the absence of this, you get the students exposed directly to the patients, which we think that is not appropriate. We'll want that they go through the simulations, they learn, so that when they get into the actual patients, then they can be able to do one.
Expressing gratitude for their substantial contribution, Total Energies highlighted the significance amidst the nation's expanding oil and gas endeavors, necessitating pro-efficient healthcare providers for remote locations.
Twalaba need not just mu country naye nga need gye tugenda okukolera ebuliisa era tusuubira nti bagenda okutraininga wano bajja kuba nga bakola need tujja kufunako abamu babere.
We anticipate that some of these medical personnel trained here may be taken to work in the oil fields, as it is an intense industry where accidents could potentially happen. With Ugandan companies Celtech Investments Limited and Philips Pharmaceuticals Uganda Limited executing the initiative, questions arise about extending such facilities to government or non-government hospitals for wider access, given the emphasized concerns over the sustainability of the training emergency center.
I mean, very expensive investment, because if it was cheap, we would have actually had it a long time on. This is an expensive investment. So, but also in terms of skill, you might not be able to have many, because as the ED indicated to you, already within here, there's already one for laparoscopic surgery, which for training. So this one is for emergency medical services. So it would be good that probably we build all these simulation centers around one point. Probably with time we can extend them to regional.
This will be a training site. Part of sustainability, we can request those who are coming for training to pay a fee for training, and the institutions which are sending them to pay a minimum fee. But the equipments are not complicated. The capital investment is what is very heavy because of buying these things you see here. the crash cart, those maybe the few things which need some maintenance, maybe the monitors, but those are few. So even the hospital can take charge, and we take them on board and maintain them like we maintain all the others.
Was the need to strengthen incidental health care, fitness for work examination, and information sharing. And the fourth was expansion of other clinical services. This facility fits very well in more than 2 of the recommendations of that study. So as Petroleum Authority of Uganda, and I have no doubt as Minister of Health, we are extremely excited this morning that this facility addresses one of the very important recommendations that was made in this study.
The Petroleum Authority of Uganda commends a French oil company for promoting local content and generating value beyond the Tilenga project's scope. Ronana Habwe, Smart 24 TV, Business Today.